So could you provide an overview of your coaching process and how you integrate ancestral clearing into it? Like when does it come into the picture?
Sure. Yeah. The first thing that I do with a client, whether it's a new one or one that I've seen before, the first thing I do is assess the state of their nervous system. Are they dysregulated? Are they, nervous? Are they calm? What's happening there? Because really, in order for me to really do anything with someone, they have to feel safe. And in order to feel safe, the nervous system's got to feel, regulated. We have to be able to connect. And then we can learn that hierarchy to healing, regulation, connect, learn. So the first thing I do is what kind of, how are they doing with their nervous system? And often I'll start with a 3-minute breath practice, which is very interesting because if they're dysregulated or feeling tentative and they're willing to just do this little simple breath practice in 3 minutes, they've shifted their experience. The body's different. And you can see them calm down and they have a sense of safety. And some of them have like, they've been so revved up for so long, they have forgotten what that feels like. Right.
Yeah.
So you see this look on their face of relief and almost joy that their body remembers how to do that, right? So anyway, so I start there, and then I listen to their story for about 5 minutes. With my history, there are very few people in the chronic that are suffering from chronic pain that have sat in front of someone else who really knows the territory experientially. And so speaking in front of, telling your story in front of, instead of me, who really understands the space, versus Dr. Peter, who wasn't a chronic pain patient, but he understood it neurologically. Like he understood psychologically and neurologically, but he didn't understand the lived experience of it.
You've been there, yes.
Yeah, so it was fun. If it had lived, I would have been part of his team as a mentor.
Yeah.
Because having a doctor who understands the neurology and the psychology, that piece, and then have somebody who understands the lived experience, that's an interesting team. Right. Anyway, so I'm a great coach for doctors in this space that have patients that are trying to find their way through an integrated pain management program. I'm a great coach in that space.
Yeah.
So second thing I do is listen to their story for about 5 minutes. I don't give them any more than that because oftentimes in this space, in the chronic pain space, patients they identify with their story. They don't realize their story is an experience they're having, but it's not who they are. So I'm careful in that. I want them to be heard, but I don't want them to be attached to their story too much. Then the next thing I do is I bring in ancestral clearing. I like to work on the stuff in the lineage first, and help them, if they're willing, and to help them release the effects of intergenerational trauma, if that's what we can get to. It kind of depends on the ancestral clearing process is done in the moment. So it's kind of what comes up for the client in the space in the moment that's what we can work with, if that makes sense. Yeah.